Oral endotracheal intubation. For this skill, you will need the following: a bag valve device, gloves, a stethoscope, portable suction, a Yankauer suction tip, an oropharyngeal airway, suction connection tubing, a monitor with SaO2, an appropriate size ET tube, a stylet, water-soluble lubricant, a laryngoscope handle with blades, both straight and curved, a commercial tube securing device, a 10 cc syringe, and an end-tidal CO2 device. Wear gloves and any other appropriate PPE as needed based on local protocols and the patient's situation. Then initiate any appropriate BLS or ALS procedures. First, open the airway with an oropharyngeal airway and begin ventilation with a bag valve device if indicated. Next, carefully check and prepare your equipment. Check the laryngoscope to ensure the bulb will light. Inflate the cuff of the endotracheal tube and then deflate to be sure it is intact. If a stylet is used, insert it into the endotracheal tube, ensuring the tip rests just behind the Murphy's eye of the ETT. Curve the stylet over the end of the tube so it won't accidentally advance during insertion. Place the patient in the sniffing position. Position yourself at the patient's head. Check the oral cavity for secretions or other debris. Suction as needed. Open the patient's mouth with the fingers of your right hand. Remove the oral airway if present. Pull back the lips so you don't pinch them. Grasp the lower jaw and move it up and out. Remove any dentures if they're present. Hold the laryngoscope in your left hand and insert the blade into the right side of the mouth. Gently move the tongue to the left out of the way. When using a curved Macintosh blade, insert the tip into the vallecula, which lies between the base of the tongue and the pharyngeal surface of the epiglottis. If using a straight blade, insert the tip under the epiglottis. Exert upward traction on the handle of the laryngoscope until you can see the vocal cords. Insert the endotracheal tube through the right corner of the mouth until you see the tip go through the vocal cords. Advance the proximal end of the tube 1 to 1.5 centimeters past the cords. Note the centimeter marking of the tube at the teeth. Remove the stylet if used. Inflate the cuff with about 10 milliliters of air. Attach the tube to a mechanical airway device and begin to ventilate.
No breath sounds.
Confirm correct placement of the tube in the trachea by listening over the epigastrium, then mid-axillary, then over the right and left sides of the anterior chest. If stomach gurgling is present or no breath sounds are heard, remove the tube. Confirm placement of the tube using a secondary method.
Good breath sounds on the left.
Place the CO2 device in the appropriate location, in this case between the tube and the bag valve device. Check the manufacturer's instructions for proper device placement and use. Ventilate for 6 to 7 breaths and observe for a CO2 reading and a waveform. The presence of CO2 after the 7th breath indicates the tube is not in the esophagus. Bag mask devices with a separate color-sensitive device may also be used for CO2 measurement. Place the device on the tube as indicated by the manufacturer. Deliver 7 breaths using the mechanical ventilation device. Note the color of the capnographic device. If the device turns yellow, it means yes, it is in the trachea. If a tan color appears, the tube may or may not be in the trachea. If purple color remains, there is a problem. Unless placement can be confirmed by another reliable method, the tube should be removed. For a bulb device, immediately after intubation, depress the bulb. Place the device over the end of the ETT and release. If it immediately refills with air, the tube is in the trachea. If there is a delay in refill and other reliable methods can't confirm correct placement, the tube will have to be removed. For a syringe-type device, place the syringe over the end of the ETT and pull back immediately after intubation. If there is a strong resistance to aspiration or if gastric contents return, the tube is likely in the esophagus and should be removed. After correct placement is confirmed, insert an oral airway and secure the tube using a commercial tube securing device. Continue to monitor the endotracheal tube during patient care and transport to ensure correct placement is maintained.
Ventilate this patient, please. No breath sounds over the epigastrium. Good breath sounds on the right. Good breath sounds on the left. Good breath sounds on the right. Good breath sounds on the left.